6, which is about light, contrast, and glare, and how to manage it. So, everybody requires light to see. And you might have noticed, if you're presbyopic, or even if you're not, if you've got normal vision, if you're reading, if you increase the light in the room, you'll be able to read better, because that improves the contrast of what you're reading or seeing. Likewise, low vision patients will require higher amount of illumination than normal patients. So the table over there shows you what is the normal illumination required for daily tasks. Reading requires about 400 lux. Classrooms require about 300 lux for normally sighted people. But people with low vision will require much higher light illumination, somewhere around 1000 lux to begin with. And high intensity diffuse illumination of 1000 lux is what usually most low vision patients will require. And this will help them break through the mistiness of their vision. How can you provide such high intensity of light? There are two ways: natural light and artificial light. So in natural light, you can have illumination from a window. Like you can see this patient sitting in front of the window and with her back turned towards the window. So on a bright day, sitting near the window will provide about 10,000 lux of illumination. And on a cloudy day, about 2,000 lux, which is quite sufficient for a low vision patient. When you're using artificial lights, remember the picture on the right hand side, it's a gooseneck lamp. You can twist and turn it and make the light focus exactly where you want on the object of regard. You can bring it close, you can take it away and point it in any direction you want. So how do you provide 1000 lux? The bulbs which are available in the market are 60 watts, 100 watts. You don't have commercially available bulbs bigger than this unless you go in for industrial lighting. So the simple thing is to remember the formula over there. I is equal to Cp divided by D square. Here, I stands for illumination in foot candles, Cp luminous intensity of source, and D is the distance of illumination from the light source. That is where an adjustable lamp comes into play. So now you use this formula and you play around with the wattage of the bulb and the distance of the bulb from the object of regard. So if you have a 100-watt bulb and you keep it 1 foot away from a book that the person is reading and you apply this formula, you will get 1000 lux of illumination. If you put the same bulb 6 inches away, you'll get 4000 lux of illumination. Now if you have a 200-watt bulb in the lamp and you keep it 1 foot away, it will provide about 2000 lux, and the same lamp at 6 inches distance will provide 8000 lux of illumination. So there, it's as simple as that. Now there are some things that you need to remember when you're considering artificial lights for your low vision patients. Number one is consistency. There should be no flickering in the light. The disadvantage of CFL bulbs and tube lights, even some incandescent bulbs, is that they flicker, right? So flickering is bad because it produces accommodative fatigue. So always have 2 lights in a row, as you can see in the picture over here. So multiple fluorescent lamps need to be installed, or multiple incandescent bulbs need to be on the ceiling. The second thing is source deterioration. Most incandescent bulbs have got tungsten filaments, and that decays with time. So after every few months, you have to keep replacing the bulbs or cleaning them of carbon deposits on top. The source is also very important. One must always choose an incandescent regular yellow bulb like that over a CFL or a fluorescent tube. The reason will become very clear in the next slide. And the fourth thing to remember is the background illumination must be 20 to 50% darker. Right, so this is the emission spectrum of an incandescent bulb. You can see beautifully that a large area of it is in red and yellow. So this mimics natural light. And there's very little blue, as you can see. But if you look at the CFL bulb, you can see a blue peak over there. So it emits a lot of ultraviolet and blue light. And if you look at LEDs, like the ones you have up here, there is a very sharp and prominent blue peak. So CFLs and LED bulbs emit a lot of blue light, and blue light, when it is scattered in the environment, will reduce contrast, and it will be very difficult for low vision patients. Those patients who have got glaucoma or AMD will have reduced contrast to begin with, and if you ask them to work in a LED environment, his contrast will be reduced further and will be no help to him. So remember, incandescent bulbs are always better for the low vision client than LED bulbs. So there's this famous biblical saying that God said, "Let there be light," and there was glare. And as you know, with glare, there comes a drop in contrast, which is very bad for low vision patients. So for all low vision patients, you must test and provide for these. You must increase their contrast and reduce their glare. So how can that be done? Oh, we are running ahead. Right, so glare, when it's from natural light or whether it's from artificial light, it can be treated. Indoors, outdoors, a patient can wear a hat with brim or use sunglasses or visors, and indoors, one can use blinds and curtains on windows or tinted glass on windows, or work with back towards the window. So these are very simple solutions to avoid glare in low vision patients, but you have to teach them. Most people don't know about this or don't realize that this can be done. So you have to tell them about it. The other thing is to use absorptive filters. I think I'm running ahead again. No. So these absorptive filters also reduce glare and improve contrast. And there are basically 5 types. As you can see from top to bottom, they are gray, amber, orange, yellow, and plum tints, right? The first one on top, the gray one, and the one at the bottom, which is plum, they reduce the overall transmission of light. So they are excellent protectors from glare and can be used outdoors. And the other 3 in the middle, which is amber, orange, and yellow, cut off the blue light, as you know, blue blocking IOLs. So they block out the blue light and improve the contrast. So for contrast enhancement, amber is the best, followed by orange and yellow. Then let's discuss a little bit more in details about these absorptive filters. The material of the gray one is Polaroid. All the rest of them are polycarbonate. All 5 of them block UVA and UVB 100%. The gray Polaroid one blocks up to 400 nanometers of light and provides true color representation. It's an excellent anti-glare filter for outdoor use. And the other ones are medium range blue light blockers, and they are ideal for contrast enhancement. The one in the middle column for outdoor use, the one on the right hand column mostly for indoor use. There are no disadvantages to the Polaroid gray filters, but the rest of them, in them, when you use these filters, blue color appears black and green is not seen when a patient wears these filters. So one must inform the patient about this, otherwise he'll come back running to you. कि साहब कम दिख रहे हैं